It's an ordeal that most of us will one day face. We have a medical emergency that lands us in the ER.
But would you know the warning signs? The Fox Medical Team's Beth Galvin has a look at the symptoms that can't wait.
When you're in real pain, it is hard to think clearly and know what to do. So we asked an ER doctor to weigh in on the 5 signs that you need to get help right away.
You feel terrible, but is it a real emergency? To help you answer that question, Dr. Anthony Ferrara of North Atlanta Urgent Care says there are 5 warning signs that you cannot afford to ignore.
One is for an adult patient, chest pain. Any chest pain, go to the emergency room and get seen.
Chest pain can be a sign of a heart attack, and another important red flag is a major neurological change.
Having trouble with your speech, your face is droopy, trouble blinking, trouble talking, or you cannot move a limb or an arm, or you feel weakness and numbness.
Those can be signs of stroke, and so's our 3rd warning sign, a severe headache, like the worst you've ever had.
Even people who have migraines and they get headaches, I'd say once a month. If it's a headache that's totally different than what you're used to, that's an emergency. You need to go to the emergency room.
Another must-get help symptom, you're struggling to breathe.
It's not normal to have trouble breathing. Any form, either you're standing there or climbing stairs or laying down and you're feeling short of breath, or even while talking feeling short of breath.
The last sign to get to an ER is severe abdominal pain, which can mean
anywhere from the chest on down to the pelvis, just pain, that it's just not going away. And that could be a whole host of things, but again, the sooner that it's diagnosed, the better it is for long term.
But what if you get to the emergency room and it turns out to all be for nothing? Dr. Ferrara says don't sweat it. That's actually a good thing. You're happy, I'm happy, everybody's happy. And don't worry about it. We're used to it. That's what we want to find.
And here is a great tip that I learned from the American College of Emergency Physicians. In your cell phone Rolodex, plug in the word ICE, or ICE. That's an acronym that stands for in case of emergency. And you put in your emergency contact's name and number, and then if you arrive at the ER and you're not conscious, the staff can look at your phone and find your family.